better future than what the politicians in Washington are preparing to leave them. On both sides of the aisle, the finger pointing and the demonizing is getting in the way of a constructive dialogue, let alone solutions. And I believe that solutions come from us, individuals, families, local communities, and we take those solutions to Washington. We don't look to Washington to come up with a grand plan and send it out to us and tell us how everything's going to work better for us. I grew up in a small farming community in Ohio, and where I grew up, everybody works. But I made a choice to go to school. And I put myself through college, and I put myself through medical school, and I came out here to Massachusetts, and I made it my home. And I fell in love with a great guy. He's a 20-year retired Navy and Navy Reserve veteran who served during the Vietnam War. And we have 2 children, 9 and 12, in the Brookline Public Schools. And I've worked my whole life in the district and lived in Brookline for more than 20 years. And I serve my own community, Brookline, on the Brookline School Committee and Brookline Town Meeting, and I'm really honored to serve my neighbors. I know several of you here serve your neighbors, and there is really no higher calling than serving the people who live next door to you. It's really a great thing to do. It was my work as a doctor in Dorchester and in Brookline that got me politically active. I realized that no matter how good a doctor I was, I couldn't get the same outcomes for the patients that I was serving in Dorchester that I could get in Brookline. And so I worked with the state, and we brought child and mental health services into Dorchester, and we have served hundreds of children and families in Dorchester and helped them tremendously. Because of bringing communities together and coming up with solutions that worked, Mitt Romney tapped me to be as Commissioner of Mental Health. And I was really honored to serve under Mitt. He is a terrific guy, and I am so hopeful that everything is going to go smoothly for him and he's going to get the nomination. I think he is. When I met with Mitt the first time, I didn't know what to expect. So I said to him, Governor, what do you expect of your commissioners? And he said, I expect you to be bold but not reckless. I thought, okay, I can do that. And then I said, Governor, what do you know about mental health? He says, I know nothing about mental health, and that's why I want you. And it is something I've always respected about him. He hires people for their expertise, he holds them accountable, he doesn't micromanage, and he knows when he needs assistance in various areas, and I think he'd make a great president. I have a proven track record in Massachusetts of saving taxpayers' dollars and improving outcomes for the residents of the Commonwealth. And because of that, President Bush asked me to come to Washington. We settled on a role in his administration on the Advisory Council for the National Institute of Mental Health. That's the board that is responsible for making decisions about sending the money out to the states from the federal government in autism research and mental health and neurologic disorders. I was on that board not because I am a brilliant scientist. I am not a brilliant scientist. I was on that board because I have common sense. I know how to make dollars work for people, and I know how to implement things on the ground so that we get the benefit of the tax dollars that come back to us in the states. So let me tell you quickly what I think we need to do to get this country turned around. First, we need to stop racking up $1.4 trillion of debt every year. Be a good start. We need to simplify the tax code, lower the overall base rates, including the corporate rate, eliminate loopholes. Government needs to get out of the business of choosing the winners and losers. It is unconscionable in this administration when 1 in 7 Americans are out of work, and there is on the president's desk a bipartisan commission report from Simpson Bowles that has a framework that aligns with Paul Ryan's plan that nothing is getting done. And this framework, I might remind people, is the same framework that Ronald Reagan used back in the 80s to lower the rates and lead to 2 decades of unprecedented growth. This can be done, and it needs to be done now. We also need to have the courage to reform our spending, and we need to start with our programs for Medicaid, Medicare, and Social Security. I have spent my whole life serving people who are poor, sick, elderly, and disabled. and I want those programs to be there. They are not going to be there if we don't take them back to their core mission. In Catholic healthcare, where I worked for over 25 years, the nuns used to always say, Beth, we know you want to do good, but no money, no mission. And it is really true. If you don't get the money right, you can't do the good work. We must fix those programs so that we can take care of our own in America when people really need a safety net. If we don't reform them, those programs are not going to be there. The regulatory environment is killing us. I have a small business that supported my family for over 20 years, and I can tell you that we need to start with healthcare reform. It is a disaster in terms of small business and the pressure on our bottom line. These regulations are stifling job growth. We need to start by repealing the federal health care bill and replacing it with a bill that holds to these three principles. The first one is that every American should have access to quality health care, that every American should not be penalized and not have access to health insurance because of pre-existing conditions, and that these principles need to be implemented in state-by-state solutions. I can tell you from working at the federal government and at the state government, the states are much more effective at implementation than the federal government, and we need to do state-by-state solutions that work. What worked in Massachusetts is not what can work in other states. I was in this administration when we did this. We designed a plan that was very specific to us. We had 3 strong nonprofit insurers. We had a huge part of our economy that was in the medical industry. We needed to come up with a plan that was different. When we put into the plan the individual mandate here, it was because we had one of the lowest uninsured rates in the country, 9%, and this was a decision point between an employer mandate versus an individual mandate. And MIT felt strongly that it was critical that individuals be responsible for their health care and that it not be an employer mandate. And that's why it happened here. That's not the same landscape in other places. Education is very important. It was my ticket to a different kind of life. And I believe that all of our children deserve a top-flight education. We cannot deliver that when schools are built to appease unions instead of children. This is not a knock on teachers. Our teachers work so hard. Most of our teachers work hard every day with their hands tied behind their back. But when unions are calling the shots, the kids are the ones who suffer. And the best teachers will tell you that. The best teachers will tell you that I need to be freed up to do the work that I need to do. It is unconscionable that we have schools where children are just as likely to go to jail as they are to graduate from high school. That is not sustainable for America. We must have an educated populace if we are going to run a democracy. And lastly, the world is a dangerous place. We have enemies like Iran, and we have allies like Israel, and we should not confuse who is who. We need to stand with our allies like Israel, and we need to be prepared to stand up to Iran. I've done a lot of work with bullies. If there's one thing you know about bullies, you do what it takes. You stand up to them. You don't shirk. And that's what we need to do with Iran. The sad truth is, the Defense Department, like every other department, is going to have to tighten their belt. But Barney Frank will tell you that we can solve our budget problems by cutting the Defense Department. We can't. Cut the Defense Department 25%, that gives you $175 billion. We are talking about $1.4 trillion a year. I don't know about your math, but mine's pretty good. That doesn't equal. Those two numbers aren't equal. We are running a different kind of campaign. We are running a campaign to bring Republicans, Democrats, and Independents together. We are a country that needs to come together. Blaming each other is not the solution. I want to go to Washington because I have a track record of working with many constituencies across the aisle to make things work. I did that for Mitt, I did that for President Bush. I've done that in Brookline, and I believe that I can really help. I can't do this without your help, obviously. If you can certainly find out more about me on my website, which is childsforcongress.com, and we have cards here that have that. I would really appreciate your support in every way. Clearly, I need funding support. I need volunteer support. I need people to check me out, look under the hood, and make sure I'm the kind of candidate you want. I believe that first and foremost, the job is serving my neighbors. And that is what I intend to do if I can make it to Washington. So I'm happy to take Q&A if you've got time.
We do.